The commonest type of dementia is Alzheimer's disease, which is a late onset dementia. Usually the incidence is under the age of 65 is 1 in 10. Over the age of 65 it's 1 in 5, so it becomes a more common illness as you get older. In other words, the brain wears out. And the commonest one is Alzheimer's disease of old age, is also called senile dementia. And in that situation, the parietal lobe of the brain gets affected. And what frequently happens is there's a slow, progressive loss of memory, as memory is divided into 3 types: short-term, immediate, and long-term. And people can remember their long-term memory, what happened 30 or 40 years ago, but they can't remember what happened 5 minutes ago or what happened even a few seconds ago. And so it's the short-term and immediate memory that deteriorate. People in that situation realize that their memory is going, so they've got some insight into it. So they confabulate, which means they fill in the memory gaps. So if you talk to a person, they say to them, "What were you doing?" "I went to the cinema last night," or "I went to bingo," or did something else. When in actual fact they haven't left the house for years because they're not able to. But they fill in the memory gaps. Unless you've got somebody independent to talk to, they can frequently pull the wool over your eyes in that situation. So it's a slow, gradual progression, and then the memory becomes worse and worse, and then it often affects the speech. So they develop speech difficulties, naming objects, and then eventually what's called expressive dysphasia, where they can't speak at all, where everything comes out as a jumble. And that's a fairly late stage of the illness. And so it's a slow, gradual deterioration in memory, frequently with agitation, frequently with wandering, so the person wanders off and you find them on the M1 in their night clothes walking down the road at 3 a.m. in the morning, or being aggressive to other people in that sort of situation. So that's a typical example of senile dementia. There are other types of dementia. Pick's disease, which is a frontotemporal atrophy. The frontal lobe and the temporal lobe of the brain are affected, and the frontal lobe controls the social graces of the person. So the person becomes disinhibited, starts swearing in inappropriate places, often uses bad behavior or aggressive behavior, and so there's a total change of their personality. So the personality coarsens as the frontal lobe gets more and more damaged, and the temporal lobe as well. So that's Pick's disease. There's another condition called Jakob-Creutzfeldt's disease, which is a virus infection that affects the brain and produces a spongy type of brain with Parkinson's disease, and again memory loss. And there's also Lewy body dementia, which is a more specialized type of dementia. So there's probably about 6 different types of dementia altogether, but the commonest is Alzheimer's disease.